be walking us through please, am I audible? Just give me a thumbs up if you can hear me. Okay, so it would be walking us through problem framing and user journey mapping. Because of the time is fast spent. Sarah, please, can you hear?
Hello, is it my network that is like everything is breaking?
Yes.
I'm waiting for people to come.
Yes, I'll notify the group now so that more people can join in. But you can.
Good evening, everyone. My name is Abdullah Babatunde, and we are talking about problem framing and user journey mapping. Can someone confirm if you can hear me?
Yes, we can.
All right. So, in healthcare, I think the session was fully about healthcare. So, most of the time, we realize that people are not really solving the actual problem, and it's very important to be able to identify the problem, be able to communicate the problem clearly, and also to that will guide how you solve your problem in healthcare. So we're going through it briefly because of the time. I might be a bit fast. Sorry about that. So are you actually solving the right problem? Because most of the time people solve the symptoms. For instance, patients are not showing up for antenatal care. That's like a symptom of a problem. That's not really the actual problem. The reason why they are not showing up. So the root cause might be that clinics are only open during working hours and women cannot afford to lose their days. So you might actually talk to the women in that community and they might tell you that, oh, the particular menial job that they are doing, they cannot afford to miss a single day, the whole day, just because of antenatal. Like to them, they don't see it as opportunity cost, like something to profit because of antenatal. Or you might say young people are not testing for HIV. You might say that's the problem, but that's not actually the problem. The problem might be that the testing sites are in the hospital, and young people are not comfortable with the hospital because of probably the healthcare attitude of the healthcare worker whenever they go there. Also, we talk about the fact that women are not completing the immunization schedule for their children. And you might actually talk to people, and they will tell you that for every visit for the immunization that they go for, the transportation to reach where they are getting the immunization is enough, is like the total amount they are making a day, what it costs them to travel there. So when you get this kind of root cause, it makes it easier for you to know the problem to solve and realize that this particular woman, what she needs is how to cut, how to make the vaccination place closer to them. Maybe you might not want to do a door-to-door vaccination and it's not like they hate or they have anything against immunization. So what it all means is that you definitely want to get the root of the matter by talking to people who are actually being affected and not just assuming from what you can see. So usually when you are doing empathy or you are trying to understand the problem, you talk about the five whys. So five whys help you to dig deeper and understand the root cause. For instance, if they say teenage girls are taking up contraception, there's low uptake of contraception. So let's say, okay, why are people not using contraception? They might answer that, oh, they say they cannot access it easily. Why can they actually access it easily? You might find out that, okay, it is only being distributed by government health clinics. And probably this is just the um, the general hospital or the community health center. We know that that's definitely not the only way to get access. So while the clinic is the only option, you might realize that community health workers are not trained or authorized to give contraceptives. So you always have to meet a matron in the general hospital or sometimes in primary centers for the ones that get it. Why is this happening? Because of the policy. So you might realize that, okay, probably your innovation should focus on first making sure there's a policy that allows community health workers or trained community pharmacy to be able to give contraception. After fixing that, then you can now talk about your innovation of how these other health workers can improve access to contraception. So you see the essence of like trying to dig deeper into the root cause and not just addressing things from the superficial level. So when writing your problem statement, there are some things that you need to pay attention to. First is specific population. So we are defining a problem, you want to specify who exactly are you solving the problem for. The location, the demography, the gender or the age group, and even to the level of what is the characteristics of this kind of people you are solving the problem for. And then describe the gap and the barriers to the problem, not the solution. In your problem statement, you don't want to start saying, okay, you have to use digital or you want to use AI or something. And then conclude why the why it matters. So,
I am Sylvester Ameto.
so there's two things because you want to ensure that at the last part of your problem statement, you want to show the urgency, why it is important to solve that problem. An example of a single line problem statement is pregnant women in rural Ogun State, let's say Ijebu or particular rural area in Ogun State, you mentioned the rural area, are missing their third trimester antenatal visits because transport costs more than a day's income, putting them at risk of undetected complications. So you can see the communication is there and the consequence is there. The barrier is that the cost of transportation is more than their daily income, and then you define the population, the pregnant women, and in a particular rural community in Ogun State, you mention the name. So that's how you actually have a good problem statement. Don't just generalize things. Thank you. So when you see a problem, it is to really try to come up with answers and solutions. So and this is always the problem, like not trying to dig deeper on root cause of problems. Just want to quickly come up with an idea. So usually people spend so much very short time on problem and spend a lot of time on solution. Whereas the best thing is to spend more time on the problem so that it's always very easy to come up with solution when you identify the problem people are facing. And this applies to not just general things. Even our government, you see that probably they don't want to understand the problem that people are facing because they are not talking to people. So just like about this thing said that if he has a problem, out of 1 hour, you spend 55 minutes trying to understand the problem and 5 minutes on the solution. So yeah, when you talk to a lot of people, you get a lot of data, you do a lot of quantitative study, interviewing people, focus group and the likes. You get so many things and then you want to synthesize them. Which strategy can you use? You can use affinity mapping. So affinity mapping is that okay, you get a lot of on organized data, what the people say, what you heard, what you observed and the likes. And then from there, you try to drop a pattern of what the things are the things. Maybe some of the patterns you saw is that okay, there's poverty, people are unemployed, there's problem of transport, there's a problem of facility not even equipped, and or the attitude of the people at the facility. So you draw different patterns. So from there, you try to look at what is the insights to generate from this, and then that will now bring up the design opportunity, like what you actually want to solve. So can you still hear me? So we having an example that actually make it more practical. So for instance, you when you're getting a team, what makes a team? It feels active and focused on the end user. It summarizes the common pattern or interest takeaway based on the cluster of data points and tells you something. So for instance, look at this. You are trying to create a team. This is not a good team. When you get data, first a girl says about contraception, a girl says hospital takes long and are too expensive. Doctors can change the price if they want, and it's easy to be seen there. Another I want to talk about the fact that cost is more important than safety or pain in weighing AB options. You can always find a way to pay for an AB if you need to. Another says first choice provider is pharmacy because it's quicker, easy, discreet, or maybe doesn't work. The doctor because it's safe, or maybe too expensive. The number is out of desperation. So these are different um, responses you've gotten from people. So you cannot say the team is the factors in abortion decision. Of course, that's not the insight that you get from it. But look at a better way to bring the team is that cost and privacy of the method are top concerns of health. So many of them keep talking about the cost and then the privacy. They don't want people to see them. They don't want to be known that they are there. So that's like the team that emerge from all the things people are saying, not factors in abortion decision. So that's like how you come about things and get responses from different. So from the things, then you bring about insights. Insight is like a remarkable realization that you can use to better respond to your focus challenge. So different kinds of insights can be generated. You can find that challenges can be conventional wisdom, a statement that extrapolates individual story over arcane truth, something that allow us to see our design challenge in a new light and intention. So let's look at some examples, like a case study. So ask phrase like a solution which my friend used with esteem. So it's about sexual and reproductive health of young people. So they're trying to imagine innovative sexual and reproductive health interventions for Nigerian youth. So when they talk to people, Adiza, 25-year-old, she said, I want to learn about many things. I don't even know how the law about abortion in my country. So the insights you can get from this is that sexual information should include dimension of sex beyond just biology to cover topics such as pleasure, consent, healthy relationship, and sexual orientation. So find out that like in the current curriculum in secondary schools, they only talk about the biology, they don't talk about the other social part of it. And people just find out this on their own, like without being aware from like the educational pathway that we already have. Femi says, I browse online because nobody will report or judge me. They talk about due to sexual and religious restrictions, youth are forced to navigate stigma and discrimination situations alone. So in the middle of the night, people just try to surf the internet to understand a lot about sexual health because they are not free to talk about it in their community. So from people's responses, you can generate insight of what it actually means in the design perspective. Another person said, I went to a HIV clinic just to see a friend, but was not comfortable at all. Imagine the person does not even have HIV, it's not even HIV. He just went to see someone, and people are already looking they also like that's kind of stigma that exists. Youth wants real-time anonymous access, sexual health information and services. Just imagine like a 17-year-old or 18-year-old they're sexually active already, but she walks into a general hospital like in Nigeria, for instance, and met the matron who's like 45, 50 years, that she wants condom or she wants a injectable contraception. I'm very sure like the way you picture it, the kind of response she will get, and like she will probably not even get that particular thing she wants because the varsity is not his friend. And with or without giving her that, she's already sexually active. She will still do what she wants to, and that's the problem. And then you see why people are not getting access to some of these things because of the discrimination and stigma that young people have. When I Google my infection, it usually concludes that I may have chlamydia, gonorrhea, or HIV. These are learning about their sexual health information in isolation, often from the internet, can be unreliable and inaccurate. So this is another challenge. This is an insight that you can get from people. You see that people are trying to get information, but there's no reliable place they can get. They just ask now people just ask AI for every single thing because they are scared of talking to real human beings and they would rather just believe the one that they are not sure about. So I feel more comfortable talking to a stranger than someone that I know. That's another response that someone gave. And what can we generate from this? The youth desire to be well informed on SRH, but do not trust their parents, siblings, friends, ability to provide due to lack of expertise and trust. So like that can also inform how you design because you find out that people don't want to be seen for SRH products. They don't want someone who they know to provide SRH services to them. They prefer someone that is a stranger. So imagine you connecting a stranger to people in so for this kind of young person, even if you like bring okay in your community, you get access to this and this. They don't want someone that is familiar with them already. They want someone that is foreign. So you see the opportunities here and how you can easily design your solution to fit into what people are interested in. So look at this same example from the responses that I've gotten. The team, cost and privacy of the method are top concerns of girls. So what are the insights that generate from this? I guess it's clinic and hospital at high costs, low return option for abortion care. Guest knows the hospital is a safe option. They've already said it is safe, but they will still choose the unsafe method instead because it does not the hospital does not give them the privacy and it's also expensive. Also, guess the abortion method as a clean, discreet, and recommended by trusted partners. So, from the things, you can generate this insight of what girls are actually think based on the things that you've gotten and the responses that you've gotten. So, this is like a pathway of designing solution and understanding the problem first. From talking to everything starts with getting data from the people you want to solve it from. Talk to a lot of people, get responses. From there, you try to aggregate it, bring out some things from it. From the team that you bring out, you generate insights that can guide the solution that you want to do. So if you follow this process, coming up with the solution will take very short time. So some questions that I might also push from your insights is this something we already from existing literature or does it free and new? So of course that's another thing. Apart from talking to people, you also want to read a lot about the problem online from different sources that have been published. So and then now you what you are getting your comments, you are looking at it. Is it the same with what existing literature have said? Is it surprising or non-obvious? Does it point out to an interesting represent some tension or contradiction? Does it describe an important user need or behavior? Do you feel excited and engaged when you hear it? Does it make you think of the ideas? Is it memorable? Will I tell a friend or colleague about it later? So these are things that you might want to think about when you're pushing your insights. So look at these insights. Which one do you think you want to choose that will guide what you want to design? First is that girls sees clinic and hospitals at high cost, no return option for abortion care. So that girls know the hospital is a safe option, but they still choose the unsafe method instead. Let's see. Sorry, there are a lot of background. You have a question. So anyone, which of the insights will you choose? to work with for your solution. The first one is talking about the fact that the hospital has high cost, low return for abortion care. So that means if you want to go with that, you are trying to see how can we make the hospital less costly and higher return for abortion care. Second one is that guest knows that HIV is a safe, hospital is a safer option, but they will choose the unsafe method. How can we make guests choose hospital despite knowing that it's a safer option? How can we like limit the barriers? Guests seek abortion method that are cheap, discreet, and recommended by trusted partner. So how do you make sure that people you leverage who people trust to access abortion care in hospitals? So these are like three different insights that you can generate, and you can solve a problem that actually pay attention to this insight that you generated. So let's quickly talk a bit about persona. So persona is a fictional representation of broader user group. So when you're solving a problem, you want to have like someone that like a representation that is typical of the people that you want to solve it for. Of course, not everybody will fall into that. You have outliers, but like something that gives you a perspective of the kind of a typical person you're solving this problem for. So usually, persona is a synthesis of the available things. So you want to design something like this. You have a name for it. You have a profile. Um, what you think. Now we are talking about contraception. What's their knowledge, their barrier to contraception, their confidence, motivation. So they just give you like an example after you've gotten this data of a typical person that this problem is affecting. For instance, Tabitha, just a name in the community, 15-year-old in school, she doesn't have a phone, she has low knowledge about contraception, she trusts her friends, her motivation is strong pressure to abort in order to finish school, fear of parents and finding out. What's our major barrier is the first, fear of being seen and needs adults to accompany her. So that's like a typical person you're solving it for. If you have this kind of thing, it makes it very easier for you to solve a problem that actually to create a solution that solves the problem. Because now you have a typical example of who you are solving it for. Of course, when you launch and from the testing and prototyping, you can expand gradually your scope. But you want to first start with people who are like the typical problem that you want to solve, and then you design for that, and then later you can expand what you are doing. Why is it important to create a persona? When someone on your team needs help making a decision, you always refer to persona. But don't forget this is a particular kind of person we're solving this problem for. So that you don't just get lost when you're so excited about the solution or the technology you want to use for your solution. With persona, you can ask questions like, what would Tabitha think of this design choice? What would Ella think when access this trap mobile phone? So when you keep referring to the typical person you're solving the problem for, it makes your solution more realistic, solving a actual problem that exists. I know that you have actually solved for one person. And of course, that one person represents a lot of other people who share the same characteristics and they'll be happy to adopt it. And then you modify based on what the responses say. Let's go quickly to journey mapping and stakeholder mapping. See how some time. Can you see me? So if you have questions, you can just note it. Then we can take the question. Hello, am I still on? Hello, can you hear me response? So what's journey map? Journey map is like a visual representation of person's experience when interacting with your innovation. So yeah, this when you draw a journey map, it makes your innovation go from invention to actual innovation. It makes it go from focusing on just the technology, like the technology that you're probably building. Okay, I've been in mobile phone. Okay, but you hear that. What's the actual solution? Your actual innovation, the actual like the entire process, the entire experience. For instance, if you want to use child egg to order for food, the experience is not just the app. It's not just about the app. How did you even get to know about Chowder? How did you even get to understand the app? Get the app? How did you even now interact with the app, make your payments, expect the experience of waiting for your food, how do you make it seamless? Then after getting it, why do you return back to the app? So that's the entire journey experience. It's not just about okay, we just develop an app and they think it will solve the problem. They of course try to partner with how the vendors you onboard on the app and the entire stuff. So that's the journey map for the when you're talking about solving a problem. So you should always have a journey map when you're solving a problem because it makes you focus less on just the technology or the very tiny part of what you're doing and see the entire process as an individual. You're solving problem for human beings. So when you're doing the journey map, you want to highlight the user goals people you are solving it for, what exactly are they interested in? Okay, they're interested in getting contraception without people judging them, maintaining privacy and at a very affordable price. That's their goal. So how do you want to design something like that? How do you address the pain points? So their experience, you want to capture that, the barriers, the duration, and the current experience versus ideal experience. So usually journey map, so the entire process, okay, they search, they discover, they purchase, and then they return also. So let's say Lizzie is an example. She shopping for a dress. First, she search online. She has a very limited budget. She doesn't have so much money. She's searching for the shoe. She cannot find her dress size. Then they refine her search by size. She was able to find a fitter on the app, and then she fit out, and then she was able to find not many listings, doesn't find many options, and then find an item but needs confirmation for stock. Long wait time for the response. Then she later hears back from the store, likes the item, and then she buys it. And then she gets like an email for feedback, and then she was able to come back again to purchase. So that's like the journey experience. So the key steps is to identify the journey is the clinic experience. Let's say um Tabitha that we use for instance, you build a solution, okay, I can see now get access to contraception secretly and the likes, and then you probably created a let's say your idea is about creating a if you have, let's say you are building a digital solution and she has just a small phone, then she can use, okay, you ask her to send an SMS. From the SMS, when she receives that, or she places a call to the facility where you guys are working for that she needs contraception and you're able to ask her some questions and it gets delivered to her doorstep in a box that is anonymous, that is like does not show that it's probably a condom or anything, and she's able to get it, and she's making very the payment is also very seamless and it's cheap. So that you want to describe how does she find out about your solution first? That's the awareness. How do you want to create the marketing channel for them to know about what you're building? Then from that, how do they get to engage with it? How do they make pay purchase? User experience, the customer. So everything has to come out in the journey map. We don't just talk about oh we are building a mobile app and this and we end it there. It doesn't work that way. We want to show an example of a typical person that has this particular problem, and then you link the entire process to solving that problem. So a very detailed journey map will always capture the goal of the person at each stage. What's the driver? What do you think will drive this person? What's the kind of emotion they are feeling at that particular period? And then what's the pain points that you are trying to solve for each stage of the process, from the awareness to the interaction, to the experience, to the purchase, and then to for them to coming back again. Another important thing to talk about is the stakeholder mapping because people who play a major role in your innovation to be effective. These are the stakeholders from the government who are making the policy, to people in the community, to your actual target audience, to their friends. So these are people you are trying to map out. It depends on the solution you are solving. It might be an hospital, it might be an NGO, it might be a peer educator, it might be a pharmacy. Depends on the solution you're working on, and that's how you map out your stakeholder. So let's just look at an example using the Menglo stakeholder mapping. Which one? This stakeholder mapping is more of the one that compare the power and then the interest. So it's like a bridge that people use to map out stakeholder. So you can see power on this side or influence on the um or vertical axis and then the horizontal axis the interest. So look at people with high power and low interest. You want to keep these particular people satisfied. Let's say you're solving a problem on a new healthcare innovation about remote patient monitoring. So they have high power and low interest. These are the hospital boards. They are the ones that determine a lot of things, but they don't really have so much interest in what is happening on day-to-day activity of the hospital. Or anything they say make a lot of influence. So you want to keep them satisfied. You want to make sure your innovation is aligning with their own directive. It's aligning with probably the strategic plan of the hospital, the insurance and the IT. So the other column is high power and high interest. So you manage these people closely because they are people that are involved in the day-to-day activities. And then they also have a very high power, like the clinical champion, the doctors in the hospital, the regulators. Then people who have low power and low interest, the media houses, the supplier, the academic researchers. So we want to just monitor what they are saying to be able to, in case the media say anything that is wrong, we want to quickly correct that. They don't have so much power. They cannot really bring down your innovation, but and also they don't have so much in day-to-day activity affecting the innovation you're building. Then the last one is the people who are low power but have high interest. You have to keep them informed. For instance, the patients, your target audience, the nurses in the hospital, the caregivers, the families, the pharmacists. They don't have the power to say, oh, we are not approving this, but they are the ones that keep things running every single day. So you have to keep them informed about what you are currently building. So that's just a way of you can use this analysis, this method analysis to group the kind of people who are stakeholders in the innovation you are building or even a community intervention that you want to use an AI generated sample for. So another important thing is user statements. So for every problem you are solving, you should be able to give one single sentence that shows the need of what you are currently doing. So you need to be able to give an actionable problem statement that summarizes who a particular user is, what they need, and why it is important. If you are solving a problem and you cannot give like one sentence about what the problem is about, then there's a problem. So you can use this framework or these templates. Who is the user? He needs to do this in order to do this. And it makes it very easy for you when you're coming up with a solution. This is an example. A leader, a multitasking tech-savvy model of two, needs to meet and socialize with others while maintaining family balance. In order to what? In order to feel like she has her own life without being perceived as an irresponsible mother. So this is like a statement that shows a need of a particular typical persona that you're solving the problem for. So probably you're trying to see how this particular person is able to achieve what she needs to meet and socialize with people while maintaining a family balance. So that's the solution you're trying to solve, and then you're able to address it effectively. What makes a good need statement? You describe a specific user. You have to be very specific about the target people you are solving problem for. Very important. And no more than just a statement of fact, it makes what you feel. For instance, look at an example. The teenage girls need more nutritious food because vitamins are vital to good health. And the other one is a teenage girl needs to feel more socially accepted when eating healthy food because for her, the social risk is more dangerous than the health risk. So when you frame things, you want to pay attention to how people feel because that's actually what people are doing. The number of times people will judge others that don't you know that this is wrong? Don't you know that smoking is wrong or something? But they are more particular about how they feel. It's not that they are not sure. It's even on like the cigarette box that they are liable to die young, but people don't care because of how they feel. So feeling is very important in designing solutions. So I want to understand what is the actual driver for this particular person. So for a teenage girl, for instance, she's not thinking about health. Health is not, it's the parents that have problem with that one. But she's thinking about what is socially accepted, what her peers are interested in, what they like, what they are criticizing. So that's how you be able to pay attention to what she wants. And then you see this playing in adverts. You see Traveling noodles when they are making their adverts. They try to pay attention to these things. They are not just talking about the nutrition, but making the people they are targeting feel what is their main driver. It's not just about it's a very nutritious food and blind, but trying to show the experience, the social experience, because that's what people they are targeting are interested in. So yeah. So things to note is that you thinking about the user's need as a verb rather than a noun. Does this need statement between to spark solution ideas for you? Does the statement capture the importance of what solving this needs and what it means to users' life? So I want to understand what it actually means to people's life. People perceive things in different ways. So I want to know what is the actual feeling, the pain factor of this person, not what you think. So the last thing we're talking about is the how might we statement. So for every problem you're framing, for every problem statement you're writing, you should always end with how might we statement because that's what will drive what you're trying to build. So for instance, this is an example. How might we design services or programs that promote pre-exposure prophylaxis awareness and used to prevent HIV infection among at-risk youth in Nigeria? So after getting a lot of data from what people have said, the insights, the research, you've done the insights, and then you bring everything together. So able to generate a statement that will spark the innovation that you're trying to build. So this is a very clear one. That how might we design a service or program that promotes the exposure prophylaxis awareness and use to prevent HIV among the defined population at risk youth 14 to 24 years in Nigeria. So you see that the population is very defined, and then what you are actually seeing as the main problem, which is programs to promote pre-exposure prophylaxis and awareness. So from the general how might we can also come up with sub things. How might we stimulate the demand? Of course, people don't even see it as important. So how would you want to stimulate young people to see prep as something that is important, that's something they want to get? Next is how do we decentralize prep at the community level? When the demand is getting higher, how do we make sure that they don't have to go to a tertiary hospital like Root in Lagos because they want to get prep? How do we make sure it is decentralized at the community level? They can get it very easily within few steps. And how do you make it easily accessible to accelerate acceptance? So these are three different things that can come out from the general how much and this each of them will stimulate how you want to build your solution from building the awareness to building how accessible it is to them and then for them to actually get it and use it. This is another example. Parents love the idea of spontaneously getting ice cream from truck with their kids in summer, but they are worried about stickiness stop them from ever doing it. So we'll have seen that for like a parent, they like the fact that they want to buy this for their child, but every time they buy it, it's always a problem for them at home because they make a mess of it. So you can design different opportunities. How might you make a mess-proof ice cream truck that you are removing the bad thing? How might you support parents and kids to spontaneously connect through shared fun experience and focusing on the emotion that they actually want to experience? How might you turn the mess of the ice cream into part of the shared fun? So even the problem they are thinking about as the mess, how can we create fun from it? So these are three different design opportunities, and you can go for any of them based on what your team think is the most preferred. So you should always use this. How might we the action, the subject, and the what for every problem you are framing. Thank you very much. I'd like to give the question. I'm very sorry for being a bit fast. I have something myself. Sorry about it. I'd like to get questions.
All right, thank you so much for the session. I hope we've all learned a lot because I have learned a couple of things. So please, if you have questions, just unmute or type it in the chat box. Let's be very fast about it. Okay, since nobody has questions, but if you have questions and maybe you are too shy to say it, you can just send me a message. And then I'll relay it to the facilitator. All right, thank you so much, sir, for the amazing session. Um, I hope we've all learned a lot, like I said before. And okay, the slides. Yeah. So would we be able to get the slides?
Uh, that might be a challenge. We don't often do slides for Twitter, but I will try to get back because the slide was originally made by someone, so I will have to ask him. Yeah,
Right, all
but I
right,
don't often check slides, yeah.
all right. Okay, so regarding the slides, we'll get back to you on that. And yeah, thank you so much once again. I'd like to end the session now since there are no questions. Yes, the session is recorded. For those who are asking, yes, the session is recorded and it's going to be uploaded on the YouTube channel. So just watch out for that. I sent a link before, so I'll send the link to the YouTube channel again. Yeah. All right. All right, guys. Good. Have a good night.
Thank you very much, man.